Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging and we want to help you be more successful. And our guest today is Jordan Ruch. He's CIO at AtlantiCare. Welcome, Jordan.
Yeah, thanks, John. Happy to be here.
Yeah, excited to have you here. We got a lot of topics to key up today, but before we dive into that, tell us a little bit about yourself.
Yeah, so I've been in healthcare IT for over 25 years. My initial work was in programming and have progressive experience kind of up the chain all the way to CIO. So have spent most of my career implementing EHRs, which has been interesting. But I've learned a lot, and I think having done a lot of the roles throughout all of IT, I have a unique perspective. So it's been a good journey.
Yeah, I'm excited to talk about that because you're right. You've been in the fire. You've been in the front lines, dealing with the challenges that users face. So I'm really excited. Like you're one of Oracle Health's first users of their new clinical AI agent. Tell us about your organization's experience with it.
Yeah, AtlantiCare was the first named customer for the clinical AI agent. And we have also been a development partner with Oracle insofar as we are providing them feedback on the tool and making some enhancement suggestions, obviously with a lot of input from our provider community. And I would say the experience in the very beginning was what it often is. There were a lot of things that needed to get fixed, a lot of workflows that really didn't kind of fit with the provider workflow. The tool, wasn't as efficient as we wanted it to be. That was over a year and a half ago. So if I kind of fast forward to where we are now, it's interesting. It's one of those technologies, having done this for a while, I can't think of a lot of technologies that I've implemented that once you get it in the provider's hands, they're like, you could never take this away from me, right? Like this is something we
The
need to
best.
have forever. I can probably count on one hand the amount of times I've had implementations go that smoothly where they're like more, more, more. Um, in
That's
my
awesome.
career, we've through meaningful use and through all of the regulatory requirements in healthcare. Sometimes it seems like we're always adding more to the plate, and we're never taking anything away. We're never focusing on truly making it more efficient and kind of taking capabilities to the next level. And I think that's been our experience with CAA. Um, from a adoption perspective, we have it rolled out to our entire ambulatory practice segment. We're working on getting it rolled out to the inpatient world as well as to nursing. But the feedback that we've been getting is pretty consistent. We have it rolled out to about 400 providers across 26 specialties, and it has been a great experience. So, we get the comments like, I'm able to get home by 6 o'clock, and I'm not. By the time I get home, I'm not doing notes for 2 hours after I get home. Um, Obviously, the benefits of that are multifaceted, but for one, the notes are happening right away. When the provider has just seen the patient and everything's kind of top of mind. So I think the quality of notes that are generated from a um, completion perspective and a really kind of encompassing the whole visit has also been a benefit. So we've looked at kind of our um, quantitative metrics and how long it takes to create a note, how long it takes to close a visit. But we're also looking at some of those qualitative aspects, and it's really been positive stories in both cases.
Yeah. Not to mention the quantitative aspect from an RCM perspective of the note being closed and you can get that cash in the door quicker. We've heard a lot about that in the AI medical scribe space, ambient, note generation. I think it was interesting what you said about the workflow. And maybe it stands out because I just read a really interesting article from Craig Joseph who said, AI is not coming for your job, but it is coming for your workflow. And I don't know if he said it quite that succinctly, but like,
Yeah,
your workflow is going to change. Your job, you'll still have the job, but your workflow is going to change, which is kind of what you described, right? Like, hey, we needed to make sure that the AI and the workflow work together. I mean, you're an implementation guy. It sounds like that was key to this rolling out of the new clinical AI agent from Oracle.
absolutely. Yeah, and I think that's an interesting way to look at it. I think there are definitely jobs that are going to change in my opinion. If we think about the evolution of the technology and what we were all thinking it would do just a year ago or 2 years ago, the reality has been the growth is kind of on an exponential path. And as I've heard on your show, we don't we don't always do a really good job thinking about exponential growth and what that might mean like 2 years from now or 4 years from now, when the tool is 20, 30 times as powerful. So I think a lot of things are going to change. We've seen firsthand what a benefit it can have to a workflow. Um, it's also we benefit from the fact that it's an integrated tool. So I've implemented some other tools prior to CAA, and they're kind of bolt-on tools, right? A lot of the big vendors in the space use third-party tools for ambient note writing. And the capabilities of those tools have come a long way also in the last 2 years. But having it native, I think, comes with some benefits as well.
Interesting. So talk to us more about like your experience with the evolution of Oracle Health. Obviously, many know it as Cerner, acquired by Oracle, and now Oracle Health, and tell me more about like what went into the decision. Like, obviously, you've chosen to stick with them and roll out their AI capabilities. What's been your experience with it, and why did you choose to stick with Oracle Health?
Yeah, it's a question I frequently get asked. Um, Cerner had their challenges, and I think people that have been in the space for a long time have lived through some version of that. Um, our decision to partner with Oracle Health was a signal of confidence in the future. And I think the big the big reason why, if I could kind of summarize it down, is the ability to have the EHR system and the ERP system under the same umbrella.
Hmm.
So, Epic is, at UGM, and even the one last year, they were talking about their plans for ERP. And I think, Epic typically succeeds at the things they set out to do. So I have
Mhm.
I have no doubt they'll be successful in the ERP space and start looking at all of the Epic Workday shops. But, Oracle has Fusion and has their ERP platform very, highly fine-tuned. It's been around for a really long time. So, that was something that was intriguing to AtlantiCare. Um, our vision is really to have our ERP and EHR systems completely integrated to the point where we can see the benefits of that. I mean, everyone, I think, naturally can understand the benefits of having an integrated platform, but
Yeah.
to have it kind of all in one space is what we were after. So that was the main reason, and I think the secondary reason is probably, we've been a Cerner customer for a very long time, and
Mhm.
Millennium is a tool that our clinical team was already familiar with. So the implementation effort and the implementation investment is different if you're talking about something totally new where you're starting with a blank piece of paper, or something that you can build on and optimize and kind of leverage some of the integration points.
Yeah. I think people definitely underestimate how much built-in culture there is around software, especially something as used as an EHR, and how big of a change that is for the workforce. So I think that's really interesting. What do you expect from Oracle Health kind of going forward, and kind of its impact on AtlantiCare? I mean, obviously, whatever EHR and or ERP that you use has a huge impact on your organization. I've heard some people say, our EHR is our innovation
Hmm.
approach, which I think is
Yeah.
probably not great. But anyway, like how do what do you expect from Oracle Health kind of going forward and as part of your roadmap for AtlantiCare?
Yeah, we have a lot. So we have a 7 wave activation strategy with what we call Powered by Oracle. And we are in day 7 of wave 2 of that go live. So our command center is still open. I stepped away to have this conversation.
I appreciate you doing that.
But wave 1 was really focused on getting some of the core infrastructure in place. We completed the rollout of CAA that I just mentioned to the rest of our ambulatory providers. Wave 2 is focused a lot on nursing efficiency.
Mhm.
So we've optimized all of the documentation and all of the flow sheets and the bands that are used pretty much all day long to keep track of the status of the patient. So we've optimized those workflows pretty significantly in wave 2. We also made a pretty big investment in vital signs integration. So a lot of healthcare systems have integration in their ICUs, as you probably know, like all the observations that are collected in the ICU interface into Epic or interface into Oracle or interface into whatever tool you might have. We've taken the next step and done the same with MedSurg. So all of our spot check monitors, as part of Wave 2, are also now integrated directly into Oracle. And the results of that have been pretty compelling. Our average time from collection of vital signs to documentation of vital signs went from about 38 minutes to 2 minutes, as soon
Wow.
as we flipped the switch. So, and it may seem like that's a great reduction in time, but the real benefit of that, as you probably know, is the fact that all of those observations are in the system to take action on that much sooner. So when our providers are placing orders or our providers are assessing the patient for what the next steps are, they're looking at vital signs that have just come off the equipment, and there's zero chance for transcription error, and they
Mhm.
are 2 minutes old. So
And no one has to do that miserable job.
no one has to do that job. There's no transcription needed. The nurse, just like we talked about with CAA, and how, our whole industry is talking about how the provider's focus has kind of shifted from being behind the screen to, using ambient technology, creating the note with ambient. A lot of times the provider's looking at the patient and, doing what they enjoy doing. The same thing's true for nursing. So we're really excited as part of our waves 2 and 3 to start to get back to nursing as well, to make the process of documenting vital signs, as the example I just gave, a lot easier. But we're also looking to make all of nursing documentation a lot easier, some by the optimizations we made in wave 2, and some by what we have planned in wave 3. So there is a counterpart to CAA for providers, to do note writing for nurses. So there's a clinical AI agent for nurses as well. Um, and it'll just make that process even more efficient. So you can do a voice-based physical assessment to go along with the vital signs that came over electronically. So if you think about that whole experience, leveraging some of the technology that's available, minimizing the amount of time you need to spend in a computer, which everyone is a fan of.
Yeah. No, absolutely. And I think that has become such a massive reality for healthcare organizations is this documentation burden. And as soon as we move to EHRs, seems like everyone said, oh, wait, we can document more. We could access that data. So let's force them to through regulation, through reimbursement.
That's
And so,
exactly
like,
right.
the
Yeah.
EHR reflects this documentation burden that's come from regulation and reimbursement. It's become this big thing. Like, how else are you working to reduce that burden? You talked about two, right? I mean, the clinical AI agent documenting for the doctor and ambulatory, the nursing, vitals. That's interesting. How is that the main efforts to, reduce the documentation burden, or do you have other things as well?
We have other things planned, and you're exactly right. I think the studies show providers spend more than half their time doing documentation. Studies show that nurses spend 60% of their time doing EMR documentation, um, and 40% of their time looking for supplies or equipment. So, I mean, that does not leave a lot of time for anything else.
Yeah.
So our strategy really is focused around that reality. And we essentially took all of the activities that happen in the EHR, both on the ambulatory side and in the acute space, and laid them out and said, all right, what are the long poles in the tent? Where are people spending the most time in the system? And what is our strategy to minimize that amount of time? So, vital signs are a big one. Documentation is a big one that we've talked about a little bit on the provider side and have plans on the nursing side to make that more efficient. But also searching the record. So
Mm.
we have an AI powered clinical summary that's going live in the first part of next year that essentially will summarize the chart for handoff from a nursing perspective, or will summarize the chart for a specialist, for a provider encounter. So if you're seeing the patient for the first time in a while and you're a nephrologist, the AI summary can show you what's most relevant to you, what's changed since the last visit that is relevant for a nephrologist to see or for a cardiologist to see, depending on the type of appointment and the specialty. All of those things, all of the incremental steps that we take toward making the system more efficient have a cumulative effect. So the 25 minutes we save for vital signs, the 50% of chart time we save with the AI agents, everything is sort of adding to the same outcome, which is more time to focus on the patient.
Yeah. I love that you're working on that next. Yeah, I heard one of the AI medical scribe vendors talk about the beauty of the EHR is you have access to all the info, and the challenge of the EHR is that you have access to all the info and you don't know what's important. And when I heard her say that, I was like, this AI medical scribe is actually going to just make it worse, because we're
Yeah,
going to capture everything that was said in the visit. And so you definitely need the summarization, right? And
yeah,
interoperability is making that worse as well as we improve the exchange of data. So I think that's fascinating. You're doing the summary. I think it's essential, right? As we continue to evolve.
yeah. I agree. I think we're only scratching the surface. There is a lot of inefficiency in healthcare IT, and our goal is to, not pretend that that's not the reality.
Yeah.
That is the reality, and there is, burnout is real. The nursing shortage is real. All of these problems are something that they're not specific to AtlantiCare. This is an issue in our entire industry. So
Interesting.
it's exciting to be part of seeing some of these solutions, make a real difference.
Yeah. Shifting gears a little bit, although we just mentioned interoperability, why did you decide in AtlantiCare really to decide to sign on to the CMS Interoperability Pledge, and talk to us about what impact you think that this pledge that they had, where for those not familiar, CMS had, I think, 60 companies or something, a large number of companies come and say, hey, we're going to help address some of the interoperability problems. What was your decision in kind of being involved with that, and where do you think it will go?
Yeah, thanks for that question. It's another exciting recent aspect of my work. We were fortunate enough to go to Washington, D.C. and kind of be part of that conversation. AtlantiCare's role in the interoperability framework is that of a provider. So, of the 60 companies that were invited, some portion of those were app developers. Some portion of those were, health systems and providers. I think maybe there were 6 or 7 health
Yep.
systems there. The data networks were there. So, Commonwealth, Care Quality, the EHR vendors were there, Epic, Oracle, Athena Health, et cetera. And the goal is really around a few major initiatives to make make the systems integrated. And I think we are starting with some very real examples of inefficiency. So Kill the Clipboard is one of the ones that AtlantiCare is involved with. And it really acknowledges the fact that when a patient comes to an appointment, we ask them the same questions all the time. And we're asking the same patient the same questions all the time. Maybe they come to see us in an office and later have an appointment in the acute facility. And maybe they have a follow-up appointment after that. Even if the record's integrated, the intake process tends to be very duplicative with what's already in the chart. So we're asking you again, well, who's your PCP? How would, all these questions just get asked over and over again, or your medical history. Even if the history is there, sometimes it's not in the format that is needed for the specialty. And so we're asking for that again, or we're having you fill out a form. I think the spirit behind Kill the Clipboard is to, give patients a easy way, whether that's a QR code or an app that they have, a way to kind of check into their appointment. And in doing so, send a standard copy of their health history and their issues right into the EMR, and make it completely EMR agnostic. So it's not something that you could use at one provider and not at another provider because they happen to use a different system. This is CMS kind of leveraging that unique position that they're in to exist across all of those different flavors of EMR. So it's pretty exciting. I think, we've just started meeting. We had the summit in Washington last month, and we are just in the process of starting some of the work group meetings now to get into the details, like the
Mhm.
how this is actually going to be done, and talking to the application developers about what's possible. But it really builds on a lot of the technology that's out there. I mean, if you think about Tefka and QHINs, that isn't something that just came out in the last 6 or 8 months. That's been around for a while. It's only now are a lot of health systems starting to leverage the capabilities of Tefka to do record exchange. But other initiatives that are part of the CMS Interoperability Pledge have to do directly with that. So it's not just about the example I gave with killing the clipboard. It's also about integrating electronic health records from provider to provider, even when they're on different systems. And in my mind, when we get down to the how, as I talked about at the work group level, it's going to leverage some of those tools that are already in place. Tefka being one with the record locator service.
Sure.
Um, but yeah, it's exciting stuff. There are pledge categories that are sort of specific to each of those use cases, and the work is underway. So I think the work product of that, I think we'll be able to see in the next 6 months or so. But it's something we're all the early adopters are all hard at work on.
That's awesome. I mean, it is a problem that we all want solved. I think I get pitched every, week someone that says, "Hey, there's this problem. Why do we have to fill out the paperwork twice?" And I'm like, "Wow, you found it." But it's actually way harder to solve than most people realize as well, which I think so it'll be interesting to see what comes out of it. But you're 100% right. When I have to fill out the same form 5 times, by the third time I'm like not giving as good of an answer because I'm
Yep,
like, all right, I'm done with this.
that's right. Yeah, so answer those
Unfortunate.
questions, once in a way that you're satisfied with, save it, and then share it every time you have a visit instead of,
Yep.
you know, leave it up
Revision.
to how you're feeling that day to how much information you give.
Yeah. So, as I was preparing for this, I learned you have a Vision 2030 effort. Talk to us about that. What is it? How's it going? How long you've been doing it, and where's it headed? This Vision 2030.
Yeah, I'd be happy to. So Vision 2030 is actually one of the things that drew me to AtlantiCare. Um,
Okay.
in my previous role, I did a pretty similar function, but I actually learned of Vision 2030, and it is one of the key reasons I came to AtlantiCare. There are four kind of key pillars of Vision 2030: serving the community, workforce excellence, transformation, which, accelerating transformation. A lot of that is the Powered by Oracle 7 Wave initiative that we were talking about a little bit earlier, and expanding access to premier healthcare. So within those four kind of key pillars, I think if I could summarize it, the main the main aspect that kind of weaves between all of those is stop making incremental improvements, start transforming how healthcare is delivered, and transform at a system level how we're approaching some of these problems. So, I could speak at length about what we're doing from an accelerating transformation standpoint. I mean, you heard about the first a couple aspects of wave one, two, and three. There is a lot of capabilities that are uh, planned as we get into waves, three, four, five, and six, to leverage the investment to have a single ERP and EHR platform. Kind of, there are a lot of new clinical capabilities, but also a lot of really exciting metrics. So we have a command center that we are building out, and it really leverages the fact that we have access to data from pretty much every system in that is being used in the health system. And now that most of those are being standardized onto Oracle, it's pretty exciting to see the types of information we'll be able to show in the command center. So, I've been part of building out command centers previously, and a lot of times they're focused on patient flow, and they're focused on um, you have essentially, you create a workspace where a lot of the people that are involved in efficient care of the patient are sitting next to each other,
Hmm.
and you have lots of dashboards to kind of make that experience even better. I think our approach, again, is more about transformation, and it's more about looking at ways to make the patient experience better, make our care of the patient more efficient, and that is all part of Vision 2030. I think when we talk about what our plans are, Vision 2030 culminates in obviously the year 2030. There are clear metrics, and this is the part that really drew me in. Some of those metrics are directly about our community.
Hmm.
So, we are in the Southern Jersey region and have a population of patients who, are looking for us to lead the way. And Vision 2030 gives us clear and concise statements on how we're going to do that and how we're going to measure that. I mean, we want life expectancy to improve by 5 years by, just to give one example.
Wow.
And there's a whole series of initiatives that are focused on achieving just that. So, it gave a real sense of purpose to AtlantiCare to have Vision 2030, because we know where we're going. And it's just about executing on the tactics to get there.
That's awesome. Well, as we wrap up, we always like to finish these CIO podcasts with a little career discussion, career advice. So, what would you say is maybe the best piece of advice that you've been given in your career, that you've learned in your career, that you could share with others?
I think the first thing that comes to mind is really investing in your team. So, I've had a number of different leaders in my career, and everyone is motivated by different things. Some people have things that intrinsically motivate them. Some people are, different in the way they like to feel recognized. And I think the big lesson for me was making sure you know that, making sure you know how your team members want to be recognized, making sure that you know not only how they want to be recognized, but how to recognize them. So a lot of people in my profession, a lot of people in healthcare IT, or maybe a lot of people in IT in general, maybe don't have the same level of people skills. So that creates a environment where people want to be recognized in different ways, right? Not everyone on my team, for an example, we have a quarterly all hands meeting where our entire team gets together and we talk about our accomplishments and what's upcoming. Not everyone wants to be brought up on stage and list out all their accomplishments and,
Yeah,
hey, what a
that's
great job.
punishment, not
Yeah, what a great
celebration.
job Joe's doing. Joe, would you say a couple words? That is not what all Joes want.
Hmm.
Some people want to be recognized in different ways. And I think as a leader, my best piece of advice is try to get in tune with that in any way that you can, so that you can meet people where they are and show people that you value how they want to be recognized, and listen to it.
That's interesting. As a leader, I'm asking these questions. I always introspectively think about that's a hard one actually. Like, I guess you get to know it over time and get to know your people. That's maybe the key. But it's
Yeah,
good advice, but it's challenging advice, I think.
it's challenging, but you also learn about how you can interact better as a team, right? You learn how people, when presented with a challenge, the type of information they need to be successful, right? Because everyone's different in that respect too.
Yeah,
You learn about your team dynamics if you focus on the types of leaders that you're working with and how they like to be interacted with, how they like to be recognized.
that's awesome. Jordan, this was really insightful, and I loved to hear how you're working to innovate at AtlantiCare and really impact the lives of your staff and your patients. So appreciate you taking time, from the command center, slipping down here to talk with us and share your insights and perspectives. And I want to thank everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, Jordan.
Thanks, John.